Hello and welcome everybody to another episode of Psych Talks 2.0. As always, my name is Dr. Jack Seksenyan, and today I have a guest with me, Miss Traci Konas, who is a frontline nurse who thinks that she has had the COVID, and today she will be talking about her experiences of going through what it's like to be a patient. So today I want to introduce her really briefly and have her speak about what she's feeling and what she's going through and the experiences of being a patient and the suffering that goes along with it. So with that, Traci, can you please quickly introduce yourself and tell us your experience and what you think the audience should know about what it's like to be a potential patient?
Hey, Jack, thanks for having me on. It's super nice to see you. I'm a nurse. I've worked in the ER for 10 or 11 years, and I just recently moved away from the ER and working in a surgery center. Possibly is exposed there, maybe exposed to a friend, but tried to go to work one day and had a low-grade temperature, 99.3, and so they sent me home. Didn't want to risk exposing any patients or other coworkers. So I went home and I didn't have a thermometer, couldn't find a thermometer. I was lucky that one of my coworkers said, "Hey, let me bring you mine, you can use it. It's a really good auto thermometer." So I'm getting good temperature, accurate temperatures. A day or two later, temperatures started to go up, 100.2, 100.4, 100.8. I didn't feel terribly sick. Was mostly just tired. Spent some time just hanging out on the couch. When the temperature would go up, I would get more tired and more fatigued. Couple days of that, and I seemed to get better. Though I had this low grade temperature that just would not go away. 99.4, 99.5. Sometimes it would spike to 100. But then eventually I just started to feel okay, had some energy, was able to do some yoga at home. The next week, so this will be the second week, I felt okay, except for this low grade temperature that I just could not get rid of. So I went to go visit my doctor, had to get paperwork done to get a release to go back to work when I was ready. And a couple days after that, my temperature started to spike. So 101.2, 101.1. I had horrible night sweats. Then the fatigue started to hit. Really, really tired. Had some chest tightness. With the chest tightness came a lot of palpitations. Eventually my resting heart rate started to go up. I'm an athlete, so my heart rate's normally around 55. Started to go up around 90, which was pretty significant for me. Yeah. Which I'm assuming that maybe where the palpitations were coming from and the fever. Then the dry cough came. Very intermittent, not terrible, just slight. That progressively has worsened, so more of a dry cough. Then the chest pain started, difficulty taking a deep breath, and shortness of breath. Got to the point where I'd make sure that nobody was around. I'd go outside and I'd try and walk up the street, and I couldn't. I was so short of breath, breathing hard. Heart rate was like 130, which is super, super rare for me. And my fever is 100.8, 100.6. This would not go away. And then the severe fatigue, sleeping a lot, 12 hours. There was one point where I had some shortness of breath, just laying down and sleeping at night. That's when I was like, maybe I should go to the ER, but stupid as a nurse, we'd waited. I can take care of myself. I'm a nurse. That has resolved a little bit. I don't have much in the way of shortness of breath laying down anymore. Just the coughs, the chest pain, and the difficulty breathing, and the fevers.
I could see that you're still feeling uncomfortable when you're talking. It sounds like you have to sort of prevent yourself from coughing and kind of oxygenating yourself. Um,
Mm.
has that gotten worse, or has it gotten better, or has that changed?
Uh, well, it appears to have gotten worse, and looks like no improvement at this point.
And you haven't been taking any medications for anything?
No, and I just drink a lot of water. I stay hydrated. I don't like taking medications. I have allergies to antibiotics, so I generally try to stay away from antibiotics and medications.
Okay. And so were you so let's talk about the testing. You said before we started this meeting that you were actually tested for it, but you turned out to be negative. Can we describe this to the audience just to make sure that everybody's on the same page here?
Yeah. So 2 days after my temperature started to go up, and I didn't even really feel that I had a temperature. I didn't even know it unless I was taking my temperature. When it was 100.8, I was like, well, my work wanted me to go get tested. And so I called my doctor, no tests. Called my ER. They said, well, we won't test you unless you're dying. And I'm like, okay. So where do I go for a test? We called the hotline. Finally was able to get a hold of someone, and I found a drive-through test site who did the PCR test, the nasopharyngeal test that goes back up into the nose. And that's how I was tested. 2 days later, I was lucky to get a 2-day response because I was a frontline worker. Most people have to wait 10 days. My test came back negative, which was a surprise to me, considering I generally don't get sick and I don't ever really get the flu.
Were you tested for the flu, or?
No, they didn't test for the flu or anything because it was just the PCR test for COVID at the testing site. The
Okay.
only test for COVID there.
Okay. But it seems like from all of your symptomology that this is something different than the flu. Can you
Oh yeah,
can you tell me a little
the
bit more?
flu is I've had the flu twice in my life, and I know what the flu feels like. It hits you in 3 or 4 hours, and then you're sick as a dog, down, high temperatures, and that's only usually for a couple of days, and then usually in a week you're better. I've been like this for a month.
Okay.
The flu doesn't last a month.
Right.
No improvement.
And I know you were also telling me a little bit about back pain. Can you tell me about that back pain?
Oh yeah, I did forget about the back. A couple other symptoms that were very interesting. Horrible back pain. I've had a couple UTIs which have led to kidney infections in the past, and it felt exactly like that. My up right where my kidneys are, the pain was intense. Just I woke up and I was like, oh my God, I think I'm dying. So my boyfriend at the time was like, let's start drinking lots of water, and get those kidneys hydrated. I still have the back pain. It's not as bad. I also had some symptoms of dizziness. And then about 4 days ago, a rash appeared, almost
Interesting.
like a viral exanthem.
Where, if you don't mind
Oh,
describing.
not at all, not at all. A couple on my left buttocks on the right side, and then a couple on my trunk, and they were painful.
Painful. Okay.
They were painful, and eventually they popped and went away, which was interesting because my mom has had this, and she came down with a horrible rash all over eventually.
When you say she's had this, she was tested positive for COVID?
She couldn't get tested.
Okay.
She's in Colorado, but
Okay.
she has been sick for a month.
I see.
Severe cough, coughing up blood. Oh yeah, fevers. She was super sick. And then she got the rash.
She had the rash. And can you tell me a little bit about how the rash looked? Was it red? Does it have coloration? Did, was it
Yeah,
pink?
they're like, it's not quite like measles. Um, and it's not like, I guess it would look a little bit like how herpes would look like.
I
That
see.
would start, but it didn't spread like that. It was just kind of in various little spots, just one or two here and there. And when you touched them, they burned. It definitely wasn't the shingles, because
Mm,
shingles affects one dermatome,
right.
and it wasn't on one dermatome. It was all over in different areas of my trunk, on my left and my right side,
So it was in multiple
different
parts of, yeah,
areas.
yeah, okay. And it kind of resolved on its own. Did you feel any
It
itching?
they did itch eventually, and then eventually they scabbed over and fell off in the shower. Um, they did itch
Okay.
eventually.
Okay. And the back pain, is it on both sides in the back, or is it one side worse than the other?
Um, it was both sides up high, and at one point, my right side would hurt a little bit more than my left. And then
Okay.
2 days ago, I had some pretty bad abdominal pain,
Was it?
which was
Mhm.
interesting,
Okay.
just out of
So,
nowhere.
did you have any diarrhea or constipation associated with that, or it was just pain that would come and go?
None, no diarrhea, no constipation, just, I mean, it was horrible abdominal pain. I was like, oh my God, it felt like almost like a bowel obstruction with poor patient.
I see. So it's interesting
It
you've
did
had,
resolve on its own.
and you've had sort of the constellation of some of these symptoms that are being reported now for COVID. So even though you tested negative, but I think we discussed it earlier that depending on when you get the test, it may show very high levels of false negativity. So it's definitely worth getting checked or getting the serology done to confirm it, because it's important as a frontline person to know if you were exposed and whether you've cleared it. It sounds like you're still going through it and you might be in the middle of this whole thing. So,
Yeah. I know that one of my coworkers called me the other day checking up on me, that works in the ER, and she said that quite a few of our ER doctors are getting their their false negatives, because they're coming in absolutely for sure they think they're COVID-19 patients. They're crashing just like a COVID-19 patient would crash, and their tests are coming back negative,
right. It depends on,
PCRs.
when the symptoms started and when you do this. So we got to be very mindful about interpreting these test results, because there's a window in which the sensitivity and the specificity could be really, really poor. And the same thing for the serology. We need a combination of tests to really prove it. Now, what are you doing to sort of fight through this? And I know I won't take too much of your time because I can see you're a little bit uncomfortable.
No worries. I do. I make sure I walk, even though I don't want to walk. I make sure I walk and stay active. I make sure I do breathing exercises like you would on a spirometer. I don't have a spirometer, but I do them to make sure my lungs are staying open as much as they can, prevent any bacteria from settling in those deep alveoli pockets. Drinking lots of water, staying really hydrated, and trying to eat well.
Awesome. And I know you said you're an athlete, and I know I've played ice hockey with you a lot, but do you have any, of course you don't have to answer these, but do you have any comorbid conditions that could have potentially led you? Because I know in general you're healthy and very active. So,
Yeah, I know I don't have diabetes. I don't have high blood pressure, or the only thing that I have had in the past as a child was asthma.
okay.
So it's possible, um, when I do get respiratory illnesses, my asthma tends to come up.
Mhm.
Um, so
Does
it's
this feel like
possible.
it's a flare up or of asthma or?
No, it doesn't feel like that tight airway that you get.
Uh-huh.
This feels deep in the chest.
Okay. And it feels like you're having hard time oxygenating. It's not about getting air in and out.
Yeah, exactly. It's not like the asthma where you have to breathe out real hard to get the air out,
Mhm.
breathe in real hard to get the air in. It's just, it's strange. I just can't seem to catch my breath.
And you said you've had pneumonia before, right? So this feels similar
When I
to
was a
that, or
firefighter, yeah, when I was a firefighter, I had some smoke inhalation, which caused some walking pneumonia,
and this
and
feels similar to it or different from that?
feels similar to it. The fatigue that comes with it, that came with it when I was a firefighter, and uh, yeah, definitely.
So what message do you have for the young and the healthy people that say, well, if I get it, I'll clear it and it'll be okay. I don't have to worry about it.
Well, I'm young. Well, I guess 44 is considered young.
Yes, definitely.
I'm super healthy. I'm an athlete. My resting heart rate's normally 55. I can run 3 to 5 miles a day. I play ice hockey. I'm a boxer. Um, I can do intense levels of activity. I'm a backpacker, and this thing took me down. This thing took me down. So we don't have immunity. There is no herd immunity to this thing. You're either going to get it and get really sick, or you're not. So my recommendation is be careful, be safe. Don't risk it. It's not worth it.
It's not. Okay, well, thank you so much for your time, Tracy, and I wish you the best and speedy recovery. And maybe when you're feeling all better, we could talk about how it's like to be back to feeling great and playing the sports that you love again.
Yeah, hopefully the rinks will open up again sometime soon.
Yeah, let's hope. I mean, that's my concern as well. Yeah, I miss hockey more than anything else. No
Yeah.
offense to my family, but so all right.
Yeah.
Well, thank you so much for
Thank
your
you,
time,
Jack.
Tracy. We'll catch up soon.
Yeah, definitely. Thank you. Take care, everybody.
Good to
Be
meet you.
safe.
All
Be
right.
healthy.
All right. Bye.
Bye.